Hi you guys. So, ooh my Jesus. I'm coming at you today with a informative video. Face is naked, no makeup. I got home from work, took a shower, and just said let me just do this video. So here it is. Um this video is going to be a personal video, and I was going to I shared some of this with you guys on another video, and some come in and some didn't. Some seen it, some may have not. For the month of September, I did a post, well, a video for PCOCS, if you guys can remember that the doctor thought that I had a mild case of that. So yeah, I went to the doctor on yesterday, which was the 7th. So we went in, just had a couple talks, about, I'm 28, and so I have been on birth control for about 2 years, and I have not gotten pregnant. Thank you, Jesus. Okay, but, the doctor was kind of concerned, and he was like, well, you're young, you should be able to, ovulate and do all that kind of girl stuff, with no problems. And, I have irregular menstruations and all that kind of good junk. So, we thought that was kind of weird, what was going on. So yesterday he did ultrasound and all that kind of stuff. So he said I'm going to have we're going to do a laparoscopy. I think I'm saying that wrong, all the way wrong, but laparoscopy is a small surgery, and they use like a thin tube. They cut an incision into my belly, and they're gonna look at my abdominal organs, my female organs. They're gonna use this tool to find like see if I have any problems with cysts, fibroids, scar tissues, because you guys know I had 2 previous C-sections. So they're gonna go ahead and do that. This is we chose this better, before we did in. Oh, we chose this minor surgery instead of a laparotomy surgery. I'm saying this word. I'm freaking this word up all wrong. So if I'm saying it wrong, please don't take it to the heart. So like I said, they do this surgery just to check for abnormal growths, tumors, cysts, fibroids, scar tissue, if anything's blocking your freaking fallopian tubes, all that kind of stuff. They use this to like treat conditions such as like endometriosis, PID, some other stuff. So they're going to check in to see if I have any conditions like inside of me that is prevent me from being pregnant or conceiving and all that kind of good stuff. So like those things, they could have cysts, I can have fibroids, I can have an infection in the inside. We can do all that, and so they're gonna see all of this doing this process. So basically, what I have to do is to prepare for this. My pre-op is sometime next week because the surgery isn't until October 26th. Um, so yeah, I'll let you guys know more about that when I go. If you guys would like to go with me to the doctor for my pre-op, thumbs up this video, and I will do a kind of vlog video. I am kind of nervous about this surgery because even though it's minor, it's still major to me. And he went over the risks that were involved in this surgery and all that kind of stuff. He did all that. He went over all that with me yesterday. And he said basically excuse me guys, sometimes this could be a 1-day surgery. Sometimes it may be required to stay over. So he gave me a sheet with some tips to prepare for the laparoscopy. I'm getting better at that word, y'all. Okay. He's like, I can't eat for certain hours and all that kind of stuff. And then like my OBG is going to perform the surgery or whatever. I'm going to be under general anesthesia. He said so I'll be asleep. So yeah, he said it takes like 30 45 minutes for the surgery. He said maybe after an hour or so after that I have to enter my bladder, and then I will have to get fluids and medicine through an IV in my vein in my arm. And I might get something to help me relax and something he said. And so um yeah, this was before the surgery. You know, I have to go pee and all that. He gonna give me some fluids, like I said, medicine through an IV in my arm, or my hand, whatever. Cause they normally put IVs like right here, because my veins right here are so tricky. Like that shit just don't work. Like I can see them, but when they go to poke for them, them bitches disappear. Like, and I'm like, just get it right here, because like you can see my veins. They're so thick right here. You can see them, like they're so dominant on my hand, on my my hand. Um, so several things could occur after. They could put a airway thing tube might be placed in my throat to help me breathe if I get general anesthesia. I'm not sure. We haven't really talked about that. Like I said, we'll talk more about everything in my pre-op. Um, I have a tube in my urethra. I have a tube, a catheter. I'm not sure. We're gonna talk about all this. I'm just giving you some stuff that was told to me, um, on the fact sheet that they gave me. So I'm just telling you guys what they told me. Then they said some of them, they're gonna shave my pubic hair, which is gonna always be shaved, baby, because I like it clean cut and just snatched. Anyway, um, so like I said, they're gonna do a small incision in my belly, and they might do more, maybe more than one, if other tools are gonna be used, but we haven't really discussed all of that. And then he said he's gonna put a little tube and it's gonna release some gas, and it's gonna make my stomach kind of swell up to try to push the my abdominal wall away from my organs, so he can see inside of me. Okay. So then they're gonna put the tube in, the incisions. They're gonna go around, look at the organs and all that. And so I'm gonna have a few stitches, he said, and it's gonna cover with a bandage. The scars, he said, it'll be very small and it'll fade over time. He said, like I said, it takes 30 to 90 minutes depending on what is done. It can take longer. If I'm found to have endometriosis, if I have scar tissue that's presenting anything, he's gonna go ahead and do all that while I'm on the table or whatever, wherever I'm gonna be. He's gonna, if it's scar tissue, anything preventing, he's gonna go ahead and fix it right then while he has me there. And then he said you're gonna go to the recovery room from 2 to 4 hours. Um, he said they say you can normally do activities the next day, but do not do any strenuous activity for about a week. Um, he said afterwards, he said if general anesthesia is used, you'll be asleep and you'll feel nothing. But after you wake up, you might feel sleepy for several hours. You may be tired and have some pain for a few days after the laparoscopy. You may have a mild sore throat from the tube in your throat to help you breathe. He just said use some cough drops to help with that. And then he told me the risk. The risk was involved with like bleeding from the incisions, of course, tiny amount of bleeding, he said. Infection, damage to an organ or blood vessel. He said, but he's never had any problems doing this procedure. After the surgery, like I said, you'll be taken to a recovery room. The nurses are gonna watch my vital signs, my heart rate, my oxygen level, all that. And like I said, I stay there for 2 to 4 hours, and then I may go home. The nurse is gonna give me any instructions, that I need from the doctor. Like I said, you get a care sheet, he said. So, like I said, the rest, you have bloating. You're gonna be bruising around the incision for a few days. Some pain around the incisions. I can't drink any freaking Coca-Colas for a couple of days. Cause you get bad gas or something. So, like, blah. So, yeah, it's a lot of stuff. A lot of risks and stuff. So, nervous about it, you guys. And I don't know anybody that has had one before. So, if you have one, have had this procedure, please tell me about it. Because I would like to know um some things. So what did you guys do and all of that? I want to know. You guys, this is very personal for me. I don't like sharing these type of things. But I have shared this journey with you for a long time, you guys. And you guys know that before I got my divorce, we were trying to conceive. And so that was not happening. So that would make me really get um get in, go to the doctor and start trying to figure out what was wrong. Because you guys, I'm young and I shouldn't be having these type of issues. So yeah, not trying to get pregnant or anything like that. I'm just want to go make sure I'm healthy and all that kind of stuff. So some stuff you just have to do and get done. So like if it has to be done, it has to be done. And there's no way from the outside to tell what's going on in the inside. So it's no way to tell. So you would yeah. It's a tough pill to swallow, you guys. It may not be major to you guys, but it's something to me, and it's very important to me. So, if you guys would like to go with me along to the doctor's visits and all that kind of stuff that I have coming up um, for this upcoming surgery, then thumbs up, you guys. Like I said, if you guys have had any of this before, then oh my head, y'all just bear with me. Um, please comment, you guys. Share your thoughts and your opinions, and I really want to know what you guys think. And if it may not be serious to you, but it's serious to me. And it's my first time ever having a surgery other than my C-sections with my children. So yeah, I'm freaking out just a tad bit. Okay. So thanks for watching, you guys, and thanks for tuning in. Thanks for listening and understanding and not judging all of that good stuff. I love you guys. Until the next video, peace.